important memory I have when I went to Drexel was really, feeling prepared going out into clinical rotations, and then going in there first day being really scared, but then just thinking about all I had learned and knowing that I was just going to be fine.
Important memory from Drexel actually happened outside of the classroom. During my first year as a student, we ran an 8K race as a Drexel PT team, so we put together several teams, and we actually ended up winning it. And so it was pretty neat because we had not only the students, but we had former graduates in addition to some of the faculty that ran as well. So the director of the program was on our team, so that was a lot of fun to do.
Small size of the program was great because in labs and practice labs, our teachers were able to come over and kind of show us and hands-on work with us and show us proper techniques, so that was really great.
I think the biggest impact that the small size of the program has had is during our labs when they split the class in half, is to give you a lot of access to the professors so that if you had questions you weren't standing around and waiting, you were really able to get your questions answered fast. So it was more efficient, especially during our lab courses.
The small size of the program made a huge impact in terms of the experience, the learning, and just the social community that happened at Drexel. And you felt like you were an individualized person. You didn't feel like you were just one big name and a number in that program.
I would describe the faculty as good role models. All of them are very good at their clinical expertise, and they're great clinicians and also great teachers.
Yes, it's a good balance of professionalism and just kind of being laid back and more of a welcoming faculty. They make it so that if you have questions, you feel perfectly comfortable approaching them.
One of the best things about the faculty at Drexel is that they all come from different backgrounds, all have different expertise. So the great thing about it is there's something there for everyone.
The relationship between faculty and staff and the students is what makes Drexel's program unique. We're looked at as their colleagues, not necessarily their students, and it just makes for a great learning atmosphere.
So one of the technologies that I felt was helpful for me was they have a standardized patient lab where you, as a student, you'll go in and you can do a full exam on an actor. So that's being videotaped, and then you get to go back, you get to re-watch your examination, you get feedback from the actor as well as getting feedback from our faculty. So I felt that was really good at getting different angles of how you are treating a patient and kind of giving you time to reflect on that whole process. My responsibilities as an orthopedic physical therapy resident include treating patients in Drexel's 3 clinics that they have, also helping to TA in their orthopedic physical therapy labs for the PT students, and then I'll be getting into doing some research soon as well. So I felt very prepared to work as a physical therapist following graduating from Drexel. They set up a lot of high quality clinicals, and I felt that prepared me well. Additionally, throughout the quarters we had experiences where we would go in the clinic as part of our coursework, and that again just gave us extra exposure to working in a clinic.
I think that finals weeks definitely prepared me for the licensure exam. We had to take a lot of tests in a little bit of time, so the intensive studying definitely helped. And I think that the rigor of the questions asked on exams definitely prepared us for the licensure exam.
So at McGee Rehab, as a staff physical therapist, I'm involved in all aspects of the patient care, mainly dealing with the physical therapy side. So we're working on balance, working on ordering equipment, working on teaching them skills that's going to help them transition to home and to the community. After graduating from the physical therapy program at Drexel, I felt 100% competent, ready to go out there. A big part of it was the wonderful clinical rotations they have that really prepare you to go out there and treat as a full-time physical therapist.